All right, my name is Liz, and I did my presentation today on cancer. So, everyone's probably heard of cancer. Several of you may even know someone who either has cancer currently or has been previously affected by cancer. But what exactly is it? It's not just one disease, but rather it's a group of nearly 200 diseases that are all characterized by the uncontrollable growth and spread of abnormal cells resulting from damaged DNA. DNA can become damaged by either internal or environmental factors. An example of an internal factor is a genetic mutation, and environmental factors could be something like tobacco smoke. Cancers are most commonly classified by the cells that they originate from. The lifetime prevalence of cancer is 1 of 2 men and 1 of 3 women. So essentially, what that means is in a lifetime, 1 of 2 men will be diagnosed with some type of cancer, while 1 of 3 women will also be diagnosed. It affects all age groups, but is most common in adults, with about 78% of all cancers being diagnosed in individuals aged 55 and older. And a couple of examples are leukemia, which is cancer of the blood, lymphoma, cancer of the immune system, and carcinoma, which is cancer of the epithelial cells. Some special considerations for exercise testing. Ideally, you would want all of your clients to undergo a comprehensive health-related fitness exam. However, requiring a comprehensive physical fitness assessment prior to starting exercise may create an unnecessary hindrance for this specific population. For this reason, no assessments are required to begin light intensity walking, progressive strength training, or flexibility programs in most survivors. Exercise professionals should be aware of a survivor's health history, including any comorbidities, health conditions, or other contraindications to exercise. Health-related fitness assessments may be valuable for assessing the degree of cardiorespiratory fitness and muscular strength and endurance that have been affected by cancer-related fatigue. Exercise professionals should also understand the most common toxicities associated with cancer treatments, including increased risk for fractures, cardiovascular events, and neuropathies associated with specific types of treatment. And lastly, medical supervision for symptom-limited or maximum effort exercise testing is no different from that of other populations. Special considerations for exercise training. Exercise can have a highly variable impact on the symptoms of those who are currently undergoing treatment. Slower progressions may be needed for this population compared to those of healthy adults. Survivors who have completed treatment, they can gradually increase exercise duration when tolerated and without exacerbation of symptoms or side effects for all activities. Heart rate reserve has been shown to be less reliable for monitoring aerobic exercise intensity for cancer survivors who are currently undergoing treatment or are early post-treatment. RPE, or percentage of heart rate max, may be better for monitoring intensity in these populations. Flexibility exercises can be implemented even during active treatment. The focus should be on joints in which a loss of range of motion has occurred. This could be from surgery, chemotherapy, radiation, or some kind of injections. And lastly, several short bouts of exercise per day rather than one single bout may be useful, especially when a patient is undergoing active treatment. So, fit recommendations. First, we're going to talk about aerobic training. The frequency needs to be between 3 and 5 days per week. Intensity, we want to aim for moderate to vigorous, and I've listed some different ways you can measure that depending on what tests you've used prior to exercising and just what works for the specific situation with the specific client. Time, you want to shoot for 75 minutes per week of vigorous intensity or 150 minutes a week of moderate intensity exercise, or an equivalent combination of the two. And lastly, for the type, we're looking for prolonged rhythmic activities using large muscle groups. So this could include walking, cycling, or swimming. Next, we're going to talk about resistance training. For resistance training, you want to shoot for 2 to 3 days per week. As far as intensity, this needs to start extremely low. So we're looking at about 30% of 1 rep max. After that, you can progress to higher intensities. However, it needs to be in very small increments. For the time, you want to go for at least one set of 8 to 12 repetitions in your sessions. And type, you can really do a lot of different things. You can use free weights, resistance machines, or you can even just focus on weight-bearing functional tasks such as sit to stand. But the main goal is that we want to target all major muscle groups. Lastly, we're going to talk about flexibility training. This needs to be done at least 2 to 3 days a week, but it's most effective if it's done every day. The intensity, you want to move through the range of motion as tolerated. For the time, we want to hold each stretch for 10 to 30 seconds when we are static stretching. And lastly, for the type, stretching or range of motion exercises for all major muscle groups should be completed. You should address specific areas of joint or muscle restriction that may have resulted from treatment with steroids, radiation, or surgery. And that can differ from patient to patient depending on what kind of cancer they had and what their treatments looked like. So lastly, some special considerations for cancer. Up to 90% of cancer survivors experience cancer-related fatigue at some point. And this can be from a lot of different things, mainly from the treatment that they undergo, but it can last for weeks to even months and years following the completion of treatment and can affect their ability to perform different activities. Bone is a common site of metastasis in many cancers. In this case, impact, volume, and intensity may all need to be modified because of the increased fragility of these bones. Muscle wasting is also often prevalent in individuals with advanced gastrointestinal cancers. So in this case, their exercise capacity may be limited. It is advisable for a patient in an immune suppressed state to exercise at home or in a hospital setting rather than a public gym. This is obviously just so they don't pick up any germs or contract anything that their body isn't able to fight off when they're in this immune suppressed state, which can be brought on by, again, a number of things. Their treatments, chemotherapy, radiation, or even certain medications that they might be taking. Patients who are receiving chemotherapy may experience fluctuating periods of sickness and fatigue, which might require modifications to the exercise program. Even for cancer survivors who are 5 years post-treatment, many still report physical limitations with crouching, kneeling, standing for a long period of time, lifting and carrying heavy objects, and walking more than a quarter of a mile. However, it is important that they are not inactive. It's just important to keep this in mind when you're working with this population, that they may not be as physically able, even up to 5 years post-treatment, as a healthy individual. And lastly, it's important to remember that no two types of cancer are exactly alike. Specific precautions may need to be implemented for varying types of cancer. And that concludes my presentation.